Mr. Chairman, in view of the time constraints, I have much more extensive work I've done on this, and I've got a set of a paper and some analysis that I'll pass out to the commissioners on the conclusion of my remarks. Let me say that I look at this proposed sale as a high-risk gamble on the future of our community. If everything works out right, we'll have additional investment, we'll be able to get more referrals in, build the volume at our hospital, and things will be fine. If it doesn't work out right, I think we could wind up eventually as simply a feeder to hospitals elsewhere with a second-rate facility here and a lot of our economy having gone over the border into one of our neighboring states. And I'm concerned about that. And the big concern I have there is if that happens, if we have sold it, we have lost virtually all our ability to cure that kind of a problem if things go wrong. So this is a much more fundamental decision than we ordinarily see. The analysis in the paper shows that there are some reasons why we may eventually see Banner or anybody else who bought this seek to move procedures and patients from here to elsewhere. Not a guarantee, but there's some economic reasons why that might be so. I would mention one other thing from that. I think a key to making this work here locally is wholehearted support from the medical community. There's a number of ways that if that's not present, this could wind up as a disaster. I would also say that as I've gotten into this, I've never heard a convincing explanation of why we need to do it. I've heard some prejudices that we won't be able to keep up as the world gets more expensive and high-tech. I've heard some opinions, but I've never seen any analysis or any quantitative analysis. And I don't think the question of why to do it has been satisfactorily answered. Mr. Chairman, that's a very brief summary. There's more in the paper, and I would say if anybody in the audience wants a copy of this, I brought some extra copies. But in summary, I would reiterate that I think that because it's a sale, it's a mistake to go forward because we won't be able to remedy problems if they arise. And that's really the basis of much of my concern. So with that, Mr. Chairman,
Okay.
was that a time indication?
Great, thank you.
And thank you, Mr. Chairman.